Hey everyone, and welcome. When you hear AI in healthcare, what do you picture? Some far-off sci-fi future? Well, guess what? The revolution isn't coming, it's already here. It's working behind the scenes, it's on the front lines, and today, we're going to dive into the real-world impact AI is making right now.
Okay, let's just kick things off with a pretty staggering number, 64%. So what's that? Well, that's how many really subtle brain abnormalities, a key cause of severe epilepsy, were found by an AI after they were missed by human experts. Think about that. This isn't about replacing doctors. It's about giving them something like superhuman vision. And we're going to show you exactly how.
So here's our game plan. First, we'll talk about the revolution that's already in motion. Then we'll see how AI is acting as both a superhuman diagnostician and the ultimate clinical assistant. From there, we'll zoom out and look at how the entire industry is building this future before we ask that big question, what happens next? All right, first up, AI's healthcare revolution. Let's be super clear here. This isn't a theory anymore. The conversation has officially left the research lab and is now happening in actual radiology departments and operating rooms, where these tools are directly impacting patient lives and reshaping medicine as we speak. So, where is AI making its biggest mark so far? I'd argue it's as a kind of superhuman diagnostician. It's like we're giving doctors a powerful new set of eyes, ones that are capable of seeing the invisible, spotting tiny patterns and anomalies that the human eye, no matter how well trained, can sometimes miss. Let's get into our first case study. This is about an AI that finds hidden epilepsy lesions. It's a tool called the MELD-Graph, developed over at King's College London and UCL. You can basically think of it as a digital detective designed specifically to hunt for the faintest, most hidden clues of epilepsy in brain scans. So, why is this so hard for a person to spot in the first place? It's because this condition, focal cortical dysplasia, is incredibly subtle. It's not some glaring issue on an MRI. It's a tiny, tiny disruption in the brain's cortex that's just ridiculously easy to overlook. And yet, it's a major cause of severe drug-resistant epilepsy. And here's the payoff. By finding these lesions so much faster, the MELD-Graph can cut the time it takes to get patients to life-changing surgery by 30%. That's a direct line from an algorithm to a better, faster outcome for a real person. That's what this is all about. But this diagnostic power isn't just about what we can see. It's now being applied to what we can hear. We're going from seeing the invisible to hearing the inaudible. A platform called TytoCare is using AI to detect lung wheezing remotely. It's essentially giving doctors a stethoscope inside a patient's own home. And the impact here is huge. We're talking a 25% drop in emergency room visits for patients with chronic conditions like asthma. By catching problems early right from their own homes, this AI keeps vulnerable patients out of the hospital. It's a real game changer. But AI's diagnostic power goes even deeper, like down to the microscopic level. Researchers at Vanderbilt are now using AI to map out entire tumor ecosystems in 3D, right down to the single-cell level. This is a monumental leap for oncology. It's letting scientists understand a tumor's world in ways we could only dream of before. All right, shifting gears a bit. Beyond just diagnostics, AI is also tackling one of the biggest, quietest crises in medicine today, physician burnout. It's becoming the ultimate clinical assistant aimed at streamlining workflows and freeing doctors from the absolutely crushing weight of administrative tasks. Just think about it. The old way. Hours and hours of manual documentation, leading to high burnout and less time actually talking to patients. Now, the AI way. It uses what's called ambient listening technology to create notes automatically, in seconds. This frees up doctors to focus on what really matters, the person sitting right in front of them. And this isn't a dream. It's happening right now, and it's happening fast. You've got companies like Oracle and Suki with AI scribes that are already cutting documentation time by 30%. And Suki is even integrated directly into major platforms like Epic and Zoom. That just shows you how quickly this is becoming standard practice. And this push for efficiency extends into the most critical environment of all, the operating room. Companies like AD-Link are bringing AI-powered precision directly to surgeons, using these incredibly advanced systems to process imaging data in real time, right there during a procedure. So what's the result? A 20% cut in diagnostic times during surgery. This directly improves accuracy and efficiency, and in a place where every second and every single millimeter counts. That kind of precision can make all the difference in the world. Now, it's so important to realize that these tools aren't just isolated experiments. They're signals of a much, much larger shift. The entire healthcare industry is now going all in, making massive investments to build an AI-driven future.
You really just have to look at the numbers. The big HIMSS conference, a major healthcare tech event, just drew over 28,000 professionals. This wasn't some niche AI summit. This was one of the industry's biggest gatherings, and AI was the absolute star of the show. And the conversations there show you how mature this all is becoming. The focus wasn't just on shiny new tech. It was on the hard stuff. How do we actually integrate this into workflows? What are the ethics? What's the real value of agentic AI, systems that can act on a doctor's behalf? The industry's thinking really deeply about how to get this right.
And the foundation is being built as we speak. A company called NimbleMind.ai just got $2.5 million in funding, and not for another flashy diagnostic tool, but for the crucial, unglamorous background work of making messy clinical data AI ready. This is the essential plumbing that's required for the next wave of innovation.
So what happens next? We've seen that the AI revolution is already here, transforming healthcare from the microscopic, single-cell level all the way up to the entire hospital system. The big question now is about its trajectory. Where is this all heading? It really just boils down to this. From mapping a single tumor cell to streamlining an entire hospital system, AI is no longer some simple add-on. It is being woven into the very fabric of modern medicine.
And that brings me to our final question for you today, and I really want you to think about this one. Based on everything we've seen, by the end of 2025, what do you believe will be AI's single biggest impact on healthcare? Will its greatest legacy be in diagnostics, finding disease earlier and more accurately than ever before? Or maybe its true value will be in streamlining operations, finally freeing clinicians from burnout. Of course, it could be both, or its momentum could be slowed by all the challenges of ethics and adoption. The path isn't set, but one thing is certain: the change is happening now. Thanks for watching.